Welcome to the Starting Point of New Jersey's Education Podcast today. Today, we will be talking with Joe Curran, the current Executive Director of the Beacon Point in Philadelphia. And also, he happens to be our board president of the Starting Point. As you know, we have been doing these podcasts, and you can find them on our education channel on YouTube, or simply go to our website. There are topics from misconceptions about grief to eating disorders. And today, Joe is going to talk about the who, what, when, where, why of substance abuse treatment. So if anyone has any questions during this podcast, you can throw them into the chat. If we have time, we will also address your questions as well. So, Joe, you've been involved in helping others with recovery for a number of years. Why don't we talk about, you were at the Philadelphia Inquirer and Daily News as the EAP director. I've known you with Ambrosia, with Pinelands, with now the Beacon Point. So give yourself a little bit of an introduction since you've done so much.
All right, Loretta. First of all, I want to say it's great to be here. And it's always great to be a part of Starting Point. And Starting Point is certainly a piece of my heart and a piece of many, many people's hearts. So thank you to Starting Point for doing this. I am what's called, I guess, a dinosaur.
Oh, no.
In the field of addiction treatment. And what that means is I've been doing it back to prehistoric days.
Oh, come on, Joe, you're not that old.
Well, I've been involved in treatment of addiction for more than 40 years. And I've done it in a variety of roles, and it has been my passion. And it's what I believe in, it's what I know can work. I've seen many, many, many miracles. I've experienced them personally, and I fell in love with the ability to see people recover from the disease of addiction. So I worked a long time ago as a counselor, and I did that for a number of years at various programs. And then I had the blessing to become an executive director at a program in Philadelphia, not far from where I'm working now, back in the early 80s. And I kept my clinical degree, my counselor degree, for years. And then I had the opportunity to go to the Inquirer and Daily News as the employee assistance director. And I got a credential in that as a certified employee assistance professional, and learned how to deal with addiction as it affects the workplace. And that was a tremendous opportunity for me for a number of years. When I left the Inquirer and Daily News, because people stopped reading newspapers, and the business end of the newspaper business basically stopped the employee assistance program. They did away with it. So I went up and worked at Livingren for a few years. Then I worked at Malvern Institute for a few years. Then I went over to Jersey for Ambrosia for a few years. And then one of the things that I learned that I love is opening new programs and putting together new programming, because the disease of addiction is always changing. And my experience is what's happening is the progression of the disease is getting faster. And years ago, it wasn't unusual to get an addict in treatment who had been using drugs and alcohol for 20 or 30 years. In today's world, the average person coming into treatment is probably using less than 5 years, maybe less than 2 years, and very possibly less than 1 year. And they're progressing so rapidly that if they don't get into treatment, they die. So the death rate for young adults is off the charts, and that goes across our entire country. So, so the role of treatment is more critical than it's ever been. And on the other hand, it's harder to access than it's ever been. So it is a very, very complicated subject that we're talking about, and a really important subject. So that's about me, but it's also about the disease.
Joe, you bring up a great point. So if we have to get people into treatment earlier today because of the death rates, I completely understand that. But what do you do when a mom calls about her son's substance abuse and asks for help? Because as a layperson, I think everybody struggles with, who do we call? How do we do this? Where is the information for us? We see the commercials on TV from treatment centers, and you know, right away we go to, do I have the right insurance? Do I have coverage? So I know that's a loaded question here, but where does that mom start?
So when a family finds evidence of a potential problem with substances, many, many times the problem has been there much longer than they know when they find whatever the evidence is. So if they find paraphernalia in the house or in the person's belongings, or they find a drug in the person's belongings, many, many times there's a lot more to it. And addicts always deny their problem. Denial is a part of the disease of addiction. So when a family finds something, some evidence of a problem, and they go to the person and say, "What's this?" the person automatically denies the problem. Another thing is that minimizing the problem is a part of addiction. So the individual is going to minimize the problem. They're going to lie about the problem. They're probably going to say, "I'm holding it for somebody else. It doesn't belong to me." If they have to own it for some reason, they're going to probably say, "It's the first time I ever did it." So if the family's smart and they go to the drugstore and they buy a drug test, and then they confront the person, not only do they say, "I found this in your room," but they also say, "Here's a cup, and you're going to give me a urine specimen, and we're going to test it right here, right now, to see if you've used anything." And if the person sort of says, "Oh, okay, I'm cornered. Yes, I used something, but it was the first time I ever did it." And that's all part of the disease of addiction. So where does the family turn? First of all, in my experience, how the family reacts to finding whatever they find is critical in this process. So if they let the person blow it off and do nothing, that's not a good thing, because the addict gets away with it. So minimally, they should have that individual assessed by a professional. Minimally, they should take that individual to someone who is qualified to do a thorough assessment of the individual's problem, whether it's a one-time use, because even if it's a one-time use, they're heading down a track which is extremely dangerous. So they should get a professional to talk to the individual. It may turn into, there are some underlying issues that need to be addressed. Maybe the substance isn't the primary problem. Maybe the individual's depressed, anxious, has some self-esteem issues going on, is looking at being bullied or treated in a way with their peers that is leading them to the wrong crowd. And an intervention can sort of turn that around in the person's life. It also may turn out there's a problem with substances and that there's addiction going on. And again, a trained professional is someone that would be better qualified to address that than the family. So minimally, they should try and get the person assessed. Now, if you're already dealing with somebody who you know has a problem, and you are the family who has been on this road as part of the progression in your life for a period of time, you already know the person has a problem. Again, you have to reach out to a professional to try and navigate, where do I go from here and how do I get there? Because as you said, Loretta, finding treatment in this world today is a complicated mess. The insurance companies are very difficult to deal with. The insurance companies minimize the problem many times. So getting the right treatment can be a challenge. Dealing with your insurance company on where to go, what's covered, how much does it pay, how much is the deductible, how much do I owe if I'm on the public side and my loved one has Medicaid, what programs take that, how do I access them? And it can be an absolute mess trying to get through that while you're trying to watch your loved one and deal with your own feelings about what's going on. So it can be really, really hard.
Joe, as you're explaining this, you know, what's going through my mind is, how do I, as a family member, okay, so I don't work at the starting point. I don't know you, Joe. You know, you reach out to professionals who, I mean, do the treatment centers help you figure this out? Or is it, you know, I don't know Vince DePasqua who's going to tell me, you know, these are the steps you can take. How do you?
So I would say both of them are good places to reach out to. So yes, most treatment programs will help you figure out how to get through the tangle of doing all that. So certainly if you have insurance and you call a treatment program, they're going to verify your benefits. They're going to figure out what's covered. They're going to be able to give you all that information. They're going to tell you whatever copays are there, what deductibles are there, and they're going to do all that within a couple hours.
Okay.
So they have access to do all that quickly. Many times, I mean, I get calls, and certainly Starting Point get calls, and Vince gets calls, and you get calls where somebody knows somebody and just is reaching out and they're saying, what do I do? How do I do
Right.
this? And when somebody calls me and they're saying, I have a loved one who has a problem, I don't know what to do. What I do is I try and briefly assess what's going on. And what I try to assess is, how serious is the problem quickly. So one of the first questions I always ask is, where's the addict? And
Okay.
and Loretta, I've gotten answers from I don't know,
Oh,
to upstairs in bed, to in a motel, to in a shooting gallery. at a certain spot to anywhere.
Right.
You know, they're at work. I've gotten it. They're at work and they'll be home at 3 o'clock. It can be any answer, but it's a question that is important to determine what you're going to sort of help the person figure out quickly. Because certainly if they tell me the addict is upstairs, sick as a dog, throwing up all over the place, and in full-blown withdrawal because they haven't had a drug in some period of time, they need to get medically assessed. I mean, there are people who die
Right.
in withdrawal. And two of the most dangerous drugs to withdraw from, the number one drug is alcohol. So while it is a socially legal drug, if somebody's withdrawing from alcohol, they can die. And the other one is barbiturates. The opiates and cocaine, and people may feel terrible, but for the most part, they're not usually going to die. But they certainly need medical assessment quickly if they're at that point of sickness.
And that's a 911 call, right?
Yeah, well, it might be a take them to the hospital call.
Okay.
Yeah. So, and then the question you raised, what insurance do you have? So, well, it's kind of a horrible question that has so much influence on what you can do.
Right.
It's a real question. So what insurance do you have, and who's going to be able to work with that insurance? Who's going to be able to take it is a real question that has to be answered.
And Joe, is that the case with, intensive outpatient programs, with, halfway house? I mean, all of the road to recovery could have different roads, correct? So if you're looking at, say, an IOP, they're going to be looking at insurances as well. A practitioner will be looking at insurances as well because they need to get paid for their time. Support groups are a volunteer group. So that's, someplace else you can go. But and how do you do them in concert? And can you do them without insurance?
So the answer is yes. So you can do it without insurance. And depending on again, like if I had cancer, the medical team is going to diagnose my cancer, and they're going to figure out the level of my cancer to determine the treatment that's needed for me. And it may be chemotherapy, it may be surgery, it may be, in some cases, as simple as change of diet.
Right.
So there's many methods that might come up, and hopefully they're going to look to provide the treatment that will let me address treatment of my cancer the first time through. Same thing on addiction. So we're looking at the same model. Okay. So my experience is if someone has addiction and they are at the point where they are entering into treatment for that addiction, my experience is I want to get it the first time around. Okay. I don't want to have a second fit. Some insurance companies have a policy where you have to fail outpatient before they will approve inpatient.
No way.
So it's not based on the depth of how much you've progressed. They have a policy that if you've never been in outpatient, you have to do that before you can go to inpatient. Wow. To me, that's discriminatory and illegal because you're not supposed to make recommendations based on a medical issue, based on prior treatment. You're supposed to base it on the symptoms and signs of what's going on in the medical process. So if someone has progressed to the point where they have enough issues that they should be in an inpatient program, then that's where they should go. Many insurance companies are very difficult for treatment programs to get days to provide treatment. Now, we are lucky in both New Jersey and Pennsylvania, because there was a law passed in both those states that if you have commercial insurance that is fully insured, not self-insured, in other words, you're not part of a big insurance plan that's self-insured, like companies like Verizon are self-insured, large companies, but smaller companies that are commercially insured, fully insured, in both New Jersey and Pennsylvania, if the plan is written in those states, there is mandated ability to get treatment, and the insurance company cannot deny it. They have to pay for it. And those plans cover both detox, which is the process of getting the person off the drug, inpatient, if it's needed, and also outpatient. So all three levels are covered in those commercial insurances, which is a really good thing.
Absolutely.
Now, the other thing I'll say is if advocacy and being willing to fight and being educated to tell legislators, you need to support this, because the laws can push for quality treatment. If the insurance companies aren't providing it, laws can be passed to basically mandate that they provide it. And that's what both Pennsylvania and New Jersey did with their laws, because there were so many people who were not getting the right treatment because there was no mandate that insurers had to pay for it. And the insurers can quote you lots of statistics saying that it's ineffective, that in other words, drug and alcohol treatment is ineffective and not dollar wise because it doesn't work. However, there's a researcher in Pennsylvania, a guy named Tom McClellan, who did a study, and he compared addiction recovery to other chronic health conditions like diabetes and asthma. And what he found is the relapses in diabetes and asthma almost mirrored the relapses in addiction. In other words, the chronic conditions. But if you have asthma and you relapse, they don't say, well, you've had 3 times, so we're not going to treat you again. Okay. If you have diabetes, they don't say, well, you've already failed too many times, so we don't want to pay for you again. They treat you. But with addiction, the stigma and the discrimination from the insurance company is they want to keep you out.
That's amazing. Joe, is the only way to recovery 12 steps? And do treatment centers insist on 12 steps, or do we have other forms of recovery? What are your thoughts about that?
So I am a believer in something, and this is kind of a hot term in the treatment world. It's called evidence-based treatment. So evidence-based treatment looks at research and what works. And there is research that says what works best. The 12 steps that were developed by Alcoholics Anonymous in 1935 are the most effective long-term treatment of the disease of alcoholism and addiction. So many programs, I mean, I certainly would want my loved one receiving what works best. There are many, many other models of recovery, and they run their own sort of statistics on how well and how effective they are. I mean, certainly people do recover in other methods. Some people go to church and it works, and they are able to stop drinking or using through some sort of religious experience. But for the largest number with the best results over the longest period of time, 12-step recovery is what works best. So my experience is most treatment programs use the 12 steps or offer 12-step meetings as part of their ancillary service in their treatment program. They are not treatment. So treatment in a treatment program is not the 12 steps. They probably have meetings at the treatment program, but when you're in treatment, you're doing treatment with a professional who's been trained to do that, and you're dealing with issues that are maybe they relate to the 12 steps, but they're personal issues with a therapist or a counselor who's helping you deal with your personal issues.
So then what is a typical day in treatment, in a treatment center, in an inpatient?
All right, so let's back it up for a second, and we'll say outpatient treatment. So outpatient treatment, traditional outpatient treatment is you have a primary counselor who you see on an individual basis. You may start seeing them once or twice a week, and over a period of time, based on your personal development and growth, you may lessen that to once a month, where you're seeing your individual counselor. And some people go to individual counseling and they're at a level where that's the type of treatment that is effective and it works for them. Then there's IOP, intensive outpatient. So intensive outpatient, most IOPs are 3 times a week, some are 4, and sessions can be anywhere from 3 hours, usually, to maybe 5 hours. And you go to a facility, you're part of a group. So there's a group that meets on a regular basis. You have a primary counselor, and you're part of that 3 times a week, usually for 8 to 15 weeks, somewhere in that range. And you go there, and some people are plugged into that level of care. Halfway house, recovery house, they're different. Recovery house is a supportive living. Halfway house implies halfway in treatment, halfway not in treatment. So halfway house has much more structure than a recovery house. So recovery houses, people live together, common problem, support of each other, rules of the house, but not as structured as a halfway house. Then there's inpatient treatment. So inpatient detox, there's hospital and non-hospital. Hospital detox implies somebody who's really sick, needs not only to withdraw and get off the drugs, but they need to do it in a hospital setting where the medical facilities literally are 24-hour nursing, 24-hour doctors. You are in a hospital.
Okay.
And certainly withdrawal can be so dangerous that people need that. Non-hospital subacute detox, you have 24-hour nursing, but the medical level is not as intense as a hospital. So you're going through withdrawal, you're being medicated, you're being helped, but you're not in a hospital setting. And then when you complete, and in my opinion, anybody who has used drugs or alcohol, and when you only need detox when you have become physically dependent on the drug. You're going to go through withdrawal.
Okay.
Now, insurance companies say you don't get physically addicted to things like cocaine, but my experience is certainly I've seen people sick coming off cocaine. I've certainly seen people where their brain was dependent and altered from use of cocaine. So insurance companies fight that you need detox for certain drugs, but the idea of detox is you have become physically dependent on the drug and you need to medically be taken off it safely. My opinion, anybody who has progressed to the point of needing physical detox certainly needs inpatient treatment.
Okay.
So if you've progressed to that point, you have screwed your life up enough that you need more than outpatient initially. So if you're going to physical detox, follow it with inpatient treatment.
And what is inpatient treatment usually? 28 days or there's no number?
In the commercial world, it's as long as you can get from the insurance company. And on my side, it's fighting to uncover the issues that validate getting more days, because they're there.
Right.
So if somebody has progressed to the point of needing detox, the issues are there. And we as clinicians need to be able to uncover them so that when we call the insurance company, we can get approval for more days because they're a mess. They're a mess.
Right.
And we as clinicians have to be able to identify and find that mess. And then the battle goes on between the insurance company and the treatment program, fighting back and forth on the insurance company may give you 3 days. And then in three days, you have to have another review and you have to have new issues. You can't say they haven't resolved the old issues. You have to have new issues to get more days. And then they may only give you 2 days. So in 2 more days, you have to have new issues again. And then they may only give you 1 day. So on the treatment side, the insurance company is hoping you're going to get tired and just go, okay, I give up.
Right.
And insurance companies do try to make deals with you. And they say, if I give you this 3 days, it's the last time. And then they have to go to outpatient. And on the treatment side, we say, no, we'll give you a call in 3 days. If they're ready for outpatient, we'll go for it. But we're not buying it now because we don't know what's going to be happening in 3 days. We may have new issues that need more time. So length of stay. So average length of stay with commercial insurance, maybe 20 days in a really good program fighting for it. In New Jersey, the mandate of the law, 28 days, which is wonderful. In Pennsylvania, the mandate of the law, 30 days, which is wonderful. Both have an addendum to add additional days if needed. But if you add additional days, you're taken away from the outpatient side. How complicated is that? So really, for a family to understand all this, and oh, by the way, I will tell you there are websites where you can go and you can look at all this. In Pennsylvania, there's an organization called DASPOP, DASPAP, DASPOP, and there's another organization called PRO-ACT. And both those organizations have stuff on the website for families about, how to get treatment, what to do, how to fight insurance companies. In Jersey, it's New Jersey Addiction Services, and there is a hotline, which is 844-278-2777, and they're supposed to help you with it. And the website, helps you. So if you just even Google addiction
Sure.
treatment, New Jersey, you might be able to find help that way.
So in treatment centers, Joe, do you mix clients, drugs, alcohol, gambling? Any addiction can be in a treatment center?
Yes. So the days of pure addictions, you don't really find pure alcoholics anymore. Most people who are addicted to alcohol have, when you do their history, they've used other drugs. Sometimes you'll find somebody, when I was 17, I used these drugs, and I knew I was heading down a bad path, so I stopped them and I just drink.
Okay.
So, I just drink now, and it's like, and you became a full-blown, alcoholic,
Right.
which was there when you were using the other drugs. You are dependent on mood-altering chemicals, and recovery, by the way, you got to be abstinent. So is it safe for somebody who was addicted to heroin to drink? The answer is no. Is it safe for somebody who was addicted to alcohol to smoke pot? The answer is no.
So there's no replacement of the addiction to be cured from one, is what I'm hearing.
Well, what happens is you do replace it, but you don't get cured from it. You substitute. You're already kind of have that plug. You just take it out of one and put it in the other, but it doesn't start over.
Well, Joe, you started this conversation where you said you were passionate about recovery. And after hearing about treatment centers and insurances, I now understand why you have to be passionate. It is hard work for the people that treat substance abusers, and also for the family. So if there's any advice you'd have to the family, how do they take care of themselves through all of this?
Well, let me go to the other side of that coin. If you have seen people in recovery and be touched by recovery, you have to be affected because it's miraculous. I mean, addicts do recover and people do change their life. And if you have to have a terminal fatal illness, addiction's the one to have, because recovery is very possible. Treatment is available and people can recover in the hundreds of thousands. I mean, it's just amazing. And there's 12-step meetings all over the place. And they are evidence of recovery. I mean, you go to a 12-step meeting and you're just swarmed with it. It's just so evident. So that makes it being passionate, being easy. What can families do? So addiction is a family disease. Not only does the addict progress, but the family progresses. And as the addict gets sick, the family gets sick too. Families can recover whether the addict gets treatment or not. Families can take responsibility for their own effects of addiction and say, I'm going to do something about my side of the street and I'm going to change me. And they can get help. And when you talked about 12-step recovery, there are 12-step programs for the family. Certainly Starting Point has tons of them that
Right.
meet in the building.
Right.
Al-anon being the one that's been around for the longest and has been helping families, almost as long as AA. It grew out of AA. When the alcoholics were meeting in one room, the families were meeting in the other. And that's how Al-anon started. same 12 steps. And the family member can work those 12 steps on themselves, and they will recover. And once the family starts to recover, the alcoholic or addict is going to change, whether they want to or not, because the family is not going to do the same things that they've always done. The family's going to change the system. So what can families do? They can get help. Even if the alcoholic or addict is saying, I'm not doing it, I'm not going to be part of it, they can get help for themselves. And once they start that process, many steps may become available. I mean, some families have had to put their loved one out of the house. I had to personally do that twice in my life with loved ones that I had to say, you got to go.
That has to be so painful.
I can't live with this anymore. You got to go. And I had to deal with all the fears that come with when you do that. I know families that have done that. I know other families that have not done that. They've let the person stay in the house, but they've still gone the path of dealing with recovery themselves, and they've changed. So when the addict is laying on the couch and says, call work and tell them I'm not coming, the loved one might say, no, I'm not calling them. No, just simply no. No is a full sentence. No is a total paragraph all by itself. No. And stop enabling the alcoholic or addict and make them clean up their own messes. And they can do that with the person still in the house and start getting the spotlight back on themselves. And so where can a family get help? Well, certainly Starting Point. And I'm just going to say that. And
Absolutely.
Certainly programs like Starting Point, which are all over the place. So, and certainly individual counselors who understand alcoholism and addiction, and certainly self-help groups like Al-anon, Families Anonymous, other programs where you just look them up online and you'll find one in your neighborhood. With Zoom going on, you can go to a meeting in Africa. You can get Zoom numbers and go to a meeting in Canada if you're concerned about initially not wanting to see anybody you know, not wanting to go to the neighborhood. You can go anywhere. So and then also things like interventions and family. There are people out there who provide services to help a family figure out what steps to take in addressing addiction to try and change the system and get the person help in treatment. And those things work as well.
Joe, this has been really informative. Thank you very much for doing this for the Starting Point. And I think you covered the whole gamut. I'm so impressed. And your passion certainly did come through. So thank you.
Well, thank you, Loretta. And I will end in saying again, Starting Point has my heart. And so Starting Point does things that I believe in and are effective for families, alcoholics, addicts, and I think if anybody is observing, watching this, please support Starting Point.
Thanks.
We are a nonprofit. Thank you.
Thank you. Have a good day now.
Thank
Thanks,
you.
Joe.